When I was a young athletic trainer, I had to, at the time I didn't know it was the good fortune, but now I do, of spending almost every afternoon with him in clinic. My father was a high school football coach, and the way he interacted with high school football coaches, parents, it was just amazing to see the interest he showed in them, not only in the injury, but into them, as their family.
Any young orthopedic resident going into sports medicine has Dr. Andrews at the top of his list in terms of mentors. Fortunately, I got an interview with Dr. Andrews and was able to secure a spot in what was my top choice, which was his fellowship. So I spent a year with him, cover NFL sidelines, and it was just a pretty special year. During that year, Children's administration contacted Dr. Andrews about the potential to start a pediatric sports medicine center here, a specialized center, which was at the time really not anything like it had existed.
Well, I'll have to thank our CEO, Chris Durovich, who had the foresight and the initial impetus to try to develop a sports medicine program for Children's Health Andrews Institute for Orthopedic and Sports Medicine. Prevention is really, in youth sports, is really my passion. Starting way back in year 2000. And, I had 5 examining rooms in the clinic where I was working in Birmingham. On Monday morning, I'd see all new patients starting at 9 o'clock. And what I started noticing in the 5 examining rooms with new patients, I'd go from one room to the other one, and they were filled up with young kids, 12, 13, 14, 15, 16 years of age, youth athletes with adult-type athletic injuries. Injuries in youth sports is at an epidemic proportion, and it's increased some 10-fold since year 2000 in our statistics. That's the problem. I was able to get Children's Health involved in prevention. We're doing a lot of research here at this institute to help prevent injuries in youth sports.
And then Dr. Andrews, his role from day one was paramount. He was the reason Children's reached out to him to say, hey, we understand that you're probably most known for your treatment of high-profile athletes and individuals, but we really like and resonate with your messaging on injury prevention in youth sports. And so this was the first Andrews Institute outside of the original, where he had the opportunity to put forth not only his passion, but the mission of serving the community and being there, as they were injured and try to prevent those injuries.
The Andrews way, which is for me, is a very special way of taking care of people. It's really our credo, and it's how we go about taking care of patients. And probably the most important aspect of being successful is showing patients that you care. They don't care about your diplomas. They don't care about any of that. All they want to know is, do you have empathy for them, or do you care for them?
I was blessed to be able to learn the Andrews way firsthand. You get to really see from decades of practice how he's evolved and changed to take care of patients now. Kind of the lifelong bond, the lifelong friendship, and just that attitude of service.
And with us, he's so proud of what we've done. He's so proud of the facility. He's proud of the outreach, over 140 athletic trainers where we're providing care. I'd just say thank you, for allowing me to be a part of that journey.
We've been able to put together a team of specialists here, from the doctors to the nurses to the therapists to the trainers, and we've been able to have an impact in an area that really needed the impact relative to youth sports and prevention. That really impresses me is that we've continued to grow and expand our facilities and our contact with patients and athletes all around this whole area. And it's the growth and development of seeing this whole thing develop. It's really made me the proudest.